Hello, this is MzCAGOMEA, and I am continuing to talk about my breast cancer. So this is video number 2. And what I did forget to tell y'all yesterday is that I did get a mammogram. After I went to see a specialist and everything, he sent me for a mammogram and a follow-up ultrasound. And I'd heard a lot of stories about mammograms and how painful they are, and I was really afraid to go and get one. But actually, it's not as bad as people make it out to be. I don't know if back in the day they had some type of torture machine or whatever that will just squish your boob until it feels like it's going to pop, but that didn't happen to me. Or it could just be the nurse who, the technician who performs it, I don't know. But they were very gentle with me, so don't be afraid to get your mammogram, because it's not as painful as people would have you think. It's not bad at all, actually. They were extra careful with the breast that was already sore, so you know, they're not monsters or anything. They're just trying to get some good pictures. And you will be put in some awkward positions and holding your arms up and standing to the side, and there is a really big machine involved, but you still do not have to be afraid of it, so make sure you go get that. So anyway, I think where I left off, I told my parents and everything what was going on, so I had an appointment with my oncologist, and they are actually the doctors who deal with the actual cancer. So I went in and saw my oncologist, and he spoke to me about everything that was going on, and I don't know, let's see, I think I did go by myself that time too. I went by myself because I was like, well, there's not really much more they could say that could shock me. You know, after finding out that you have cancer, you're gonna lose your breast, so that didn't really feel like a big deal to me or whatever. So I went in and we talked about stuff, and I told him that I was gonna keep one of my breasts. I was gonna keep my left breast and let him have the right breast. And he told me that I would have a mastectomy, which is a full mastectomy, which is the full removal of my right breast, and lymphectomy, which is where they remove some of the lymph nodes in the surrounding area, like your chest or armpits or whatever. So, and that they would do that. And then he told me, he said, you're gonna have cancer. You're gonna have the surgery in 3 days. Now, I didn't really expect it to be that fast, but I was told that breast cancer in African American women is very aggressive. It can spread very quickly, and I assumed that's what was happening when it just started out as pain, and then it just blown into a lump, and then, you know. So they wanted to go ahead and take care of it and do it as quick as possible. And he told me that in order to go ahead and take care of it, they would do all the steps that they possibly could. They would start off with the surgery, and then they would go, I would have chemo after I recovered from the surgery enough, and then I would have radiation. So I got all my instructions and everything and got ready for surgery and told my family, and I have to say I had tons of support. So it's always good if you're by yourself. You need to have a friend, or if you don't have any family around, just you need to get somebody. I mean, because I had loads of support from my family when I went to the hospital. From what I understand, the waiting room was loaded with people, so there you go. I had lots of people who love me. And one of the first things they had to do when I had surgery was they had to inject this dye into my nipples that would, I guess, show the cancer to see if it had spread or, to any other parts like my lymph nodes or, but it was, I believe, 6 injections into my nipple. And that was painful. Now, when I said the biopsy was the least painful thing I had to go through, these injections were the most painful thing I have been through. They might have even hurt worse than giving birth to my son. I would never suggest anybody just getting shots in the nipple just for the heck of it, no. But anyway, I was wheeled on down to the room, and this guy comes out, and he's dressed from head to toe, and his gown, and his hat, and gloves, and mask, and everything, and then he comes out with these big metal syringes with needles on them. And I'm thinking, what in the world kind of dye is this if they're in metal syringes, And the nurse tells me, she says, oh, you can hold my hand because it might hurt, So I'm like, okay, if I just brace myself, how you do, you just brace yourself and the pain is not as bad. So I was like, if I just brace myself for these, I'll be okay. So I held the lady's hand, and I didn't really think I would need to, but yeah, I needed that. Every time he stuck one of those things in me, he was like, oh, I'm sorry, every time. And I just be like trying to keep from screaming because it hurt that bad. It really did. It hurt. And I actually had, they put some cream on me before I went in that was supposed to numb it a little. Maybe I didn't have enough. I don't know, but it didn't really work. But anyway, after they did that, I was wheeled back up to my room, whatever, and I had to wait an hour to, for everything to show up. So when they actually took out the lymph nodes, they would be able to see if the cancer was in there. So I spent that hour. My family came in the room and visited. My son came in. They treated my son really good. They babied him up and everything. The nurses were really nice to him. So, I was happy or whatever. I mean, I wasn't scared at all to have surgery. I guess maybe because it happened so fast. It was just like, bam, you have cancer. 3 days later, you have surgery. So I didn't really have time to get scared. So, when it was time to have the actual surgery, the nurse came up and she told me what was going to happen, and that anesthesiologist came up and she shot me up in the IV, and it kind of sucked because my good arm, they can't use it anymore. You can't use your good arm, where you can't use the arm that you've had the mastectomy on. You can't use that for shots or anything like that anymore. You have to use the opposite arm. And my good arm just happened to be my right arm. My right arm was where my right breast is, and I had to have it removed so they couldn't put my IV there. So I had to get it in my left arm, and I actually ended up having to get it in my thumb because I have no good veins in my left arm. Well, that was painful, but still not as painful as getting the needle shot in my nipples. So, but anyway, she shot the IV up, and I felt it right away, but I didn't go to sleep right then. I remember getting wheeled down to the operating room. I remember getting on the table and looking around and seeing tools and everything, and then I remember looking to my right, and a lady came running across the room and shot something else in my IV, and I was out.